is a committee that, in the time I've been here, we have covered more terrain. We really can't legislate through it, but we can talk about a lot of issues. And it is one where I think, especially as it relates to all of us that will be there someday in that aging category, and so many things that we do as a federal government, Social Security, Medicare, Medicaid, take a much broader discussion than what we have here today. It needs to be fixed. It needs to be saved. And I come from the world of where I've run stuff before I got to the Senate for 37 years, and no other place quite works like this place. And I've never seen so many, a place where so many people look to it and depend upon it. So that's always a factor as we look at what we're going to do, try to do it more efficiently, more cost effectively. On the committee, as a business owner, my priority was to have healthy employees. I took on healthcare in general many years ago and did some things entrepreneurially, like turning my employees into healthcare consumers, asking them to own their own well-being. So when they get in that elderly category, they can enjoy life and not be, riddled with having to fight healthcare issues. The old ounce of prevention being worth a pound of cure goes a long way. And when it comes to like reforming Medicaid to support, Senator Casey was talking about it, home-based care. That is important. It's probably a way that if you get that right, you get the workforce training, kind of orienting in that direction, you can save money and maybe do it more efficiently. Community-based services, I think, are going to gain stride and become more important each year we get down the trail. Not only for Hoosiers, but for folks across the country, that dynamic, I think, is going to be in play, and we need to make sure we get it right. Now 1 in 5 Americans, 1 in 5 is a family caregiver. I mean, that's a big number. When you take 20% of 330 million, that's a lot of people that probably are not going to be really ready to go when that time comes, and we got to get better at it to make that work. Got one example, Cornerstone Lutheran Church in Carmel, Indiana. Decades ago, members of this church recognized the need to support family caregivers, so they established what they called a friendship group. Now, friendship groups have grown across the state, helping family caregivers know where to turn for support. I think that's important. Whenever we can do it from the grassroots up, it's probably going to be done a little better, and it's probably going to be more cost effective too. Federal policies should support family caregivers. The administration's proposed independent contractor rule will hurt caregivers, in my opinion, by restricting the independent work and the flexibility it offers. 74% of independent workers say they prefer the arrangement because it gives them flexibility to be one of those 1 in 5 of all Americans that are going to be caregivers eventually. Women who make up the majority of caregivers will be disproportionately harmed by restricting independent contracting. That's a whole other issue we have to deal with, make sure that dovetails into what we're trying to accomplish here. Inflation is still high and widespread. It's not going to go away anytime soon. It impacts all of us as we try to recruit and retain new employees, including caregiver employees. The Better Care, Better Jobs Act, which was talked about earlier, I think is going to maybe add to inflation. So sometimes we do things here, even though well-intended, might be counterproductive. The federal government wants to rebalance spending on long-term services and supports from institutional care to home-based services. Rebalancing means shifting weight from one side to the other. It doesn't mean putting more weight or more burden on trying to do it, so we have to be careful there. I introduced the Bipartisan Jobs Act with Senator Kaine to expand Pell Grant eligibility to shorter-term job training programs. I think that's going to be a win-win. I hope Senator Casey joins us on that. I think that's got a good chance of making it through this Congress. I also reintroduced the Prioritizing Evidence for Workforce Development Act to fund education in workforce programs with proven outcomes. I think that's important. This bill would help scale successful programs like the Goodwill Excel Center, which helps adults earn their high school diplomas and provides training so they can enter the high-demand, high-wage fields. In our state of Indiana, 135,000 jobs need a better high school education. We export four-year degrees in our state. Our guidance counselors at many schools do not even tell kids about jobs like will be needed, for caregiving in the home. We also need to make sure that the wages are there, so it's attractive for people to get into fields. This needs to all be guided. It needs to be promoted. And kids coming out of high school, regardless of what your trajectory is, doctor, astronaut, plumber, electrician, anything in between, need the skills that we seemed to not be delivering. And it would really come into play when it comes to what we're talking about here today. So as long as I'm here, I'm going to push that from this level. Don't dismiss what can be done in your own states. A lot of times where the laboratory of finding things that work and you can pay for actually occur. I yield back.